Stop.
We have all seen people smoke before. People smoke so often that we see dozens of people smoking every day. You might not realize it from a quick glance, but sometimes people aren't always smoking a cigarette. Sometimes people are one of the possible substances they could be smoking is marijuana. To some people, the use of marijuana is taboo and looked down upon it. A very controversial topic in society today is legalization of marijuana. Today I will talk about the benefits of marijuana, where it stands in the legalization process now, and persuade you all to be more open to the subject. Cannabis is another term for marijuana. The intended use for the plant is as a psychoactive drug and medicine. Cannabis is used to relieve unwanted symptoms. A study conducted in 1999 by the Institute of Medicine assessed the potential health benefits of cannabis. It can reduce nausea and vomiting when patients go through treatments like chemotherapy and may be a practical choice for people who don't make progress after preferential treatment. Cannabinoids have shown some promise as anti-cancer therapies. Laboratory experiments have suggested that cannabis and cannabinoids have anti-carcinogenic, anti-tumor, and anti-cancer effects, including a potential effect on breast and lung cancer cells. It can also treat muscle spasticity and chronic pain throughout the body. The use of cannabis appeared to be safer than opiates for a remedy. It can also aid in treating symptoms of AIDS patients. According to TrueActivist.com, there are 10 health benefits of marijuana. The first point is cancer. The cannabinoids obstruct tumor growth in laboratory animals and kill cancer cells. Researchers believe that the THC can be used in a targeting fashion to treat lung cancer. The second point is Tourette syndrome. Tourette syndrome is a neurological condition that usually involves uncontrollable tics, facial movements, and involuntary shouts and grunts. An experiment was conducted at the Hanover Medical College in Germany that investigates the effect of cannabinoids in 12 adult patients with Tourette syndrome. When a single dose of cannabinol was administered, the symptoms appeared to significantly reduce for several hours. The third point talks about seizures. There appear to be a lot of cases where people suffering from seizures have only been able to function better through the use of marijuana. This is because marijuana is a muscle relaxant and has proven to be an effective treatment to seizures. Procon.com describes migraines as a type of primary headache that some people get repeatedly over time. Migraines are different from other headaches because they occur with symptoms such as nausea, vomiting, or sensitivity to light. In most people, a throbbing pain is felt only on one side of the head. Doctors have been able to treat more than about 300,000 cases of migraines than common medicine because of marijuana. Glaucoma.com defines glaucoma as a disease of the optic nerve, the cable that carries visual information from the eyes to the brain. Damage to the optic nerves from glaucoma can result in lost vision and blindness. Treatments that lower the pressure of the eye both lower the risk of developing the optic nerve damage that defines glaucoma and the risk of pre-existing damage getting worse. One of the commonly discussed alternatives for treating glaucoma is smoking of marijuana, because smoking marijuana does lower eye pressure. I have personally seen how marijuana can be beneficial. About 3 years ago, my aunt had lung cancer. Her condition was so bad that a lot of the tumors on her lung were inoperable. She went through chemotherapy and lost a lot of hair and weight. There was nothing the doctors could do about her hair loss, but there was something they could do about her appetite. They gave her medical marijuana. Using this would increase her appetite so she could eat. When she started to eat again, she felt a little bit better, and my whole family could see it see it had a positive effect on her. According to an article posted on October 17th, 2013 by HuffingtonPost.com, nearly two-thirds of Americans support legalization, regulating, and taxing recreational marijuana in the state. In the article, explains that based on responses of 1,200 likely 2016 voters surveyed, a solid majority backed proposals to legalize adult recreational marijuana. The polls found that 32% opposed legalization, while 3% were undecided. Lieutenant Governor Gavin Newsom and American Civil Liberties Union representatives announced that the start of the 2-year research effort focused to legalize the recreational use of marijuana. Gavin Newsom says that we need to answer the tough questions before we put it on the ballot. He wants the research in order to move to be more convincing to others. The subjects seem to be so far ahead that not everyone is willing to wait until 2016. Two groups have filed proposals to put recreational pot initiatives on California's 2014 ballot. Mason Trivert, a communications director of the Marijuana Policy Project, tells HuffPost that voters' turnout tend to be much higher in presidential election years. We believe that 2016 initiative will best demonstrate just how much support there is for ending marijuana prohibition in California. As you can see, marijuana has a lot of potential to be beneficial to people who need it. To some people, the use of marijuana has a negative connotation. When people hear the word marijuana, one thought that might pop into their mind is that weed is a gateway drug. I think that once it is legalized, people will look at the benefits it has over the negative effects it has. I hope that if some of you who listened to my speech are now open to the idea of legalizing marijuana for its benefits over its negative effects.